Unexpected healthcare costs for 2024 with these California health plans. Hello, I am Kevin Canals with InsureMeKevin.com, and Covered California has done a very good job with the standard benefit design metal tier health plans in the sense of containing costs for many routine services that we receive at hospitals and doctors and labs. What can surprise people that is unexpected and sometimes explodes on them is the coinsurance for outpatient procedures, and they can be different depending on the plan that you have. So let's look at just the standard co-payment, which are the kind of the routine services with the metal tier plans. And many of the routine services for the silver, gold, and platinum plans are not subject to any deductible. It is just a flat payment. So for a primary care visit with a silver plan, it's $50, $35 with the gold, and $15 with the platinum. And it doesn't make a difference how often you go and see the doctor, that will be that set co-payment. So you don't have to worry about it. And that gives people comfort that they know what their healthcare costs are going to be. Now, the bronze plan is a little bit different. You only get 3 office visits at $60. And then after that, you must pay the full negotiated rate of the office visit or procedure. You do get labs at $40, not subject to the medical deductible. But you need to accrue $6,300 in healthcare expenses before you have met your bronze deductible, and then you go into coinsurance. Coinsurance is a percentage. It is the percentage of your responsibility for the healthcare service. So in the bronze scenario, once you have hit $6,300, met your deductible, that next dollar over $6,300, $6,301, you pay 40 cents of it, and the health plan pays 60 cents. And then when the deductible and the 40 cents all add up to $9,100, then the health plan covers everything for the rest of the year with in-network providers. The silver plans are a little bit trickier, a little bit more complicated for 2024. For the silver 73, 87, and 94, there will be no medical deductible. You'll go straight into coinsurance. The silver 70 still does have a medical deductible. However, the medical deductible only applies if you're hospitalized or in a skilled nursing facility. Otherwise, for those healthcare services, outpatient, that are subject to the coinsurance percentage, you go straight into it. So for the silver 70, outpatient procedure is 30%, silver 73, 30%, silver 87, 20%, silver 94, 10%. And that also mirrors pretty much for durable medical equipment, a little bit less on the silver 70 and 73. If under the silver 70, you do have to go through the medical deductible because you are in a hospital, inpatient, or in a skilled nursing facility, then that next dollar after the deductible is going to be 30 cents. And the health plan pays 70 cents. And then when all of that reaches $9,100, the health plan pays for everything for the rest of the year. But so how does this work in a real life situation? Let's say you do have outpatient surgery on your knee, arthroscopic surgery, and the bill is $10,000. And the coinsurance for the silver 73 is 30%. That means you would be responsible for $3,000, 30% of $10,000. The silver 87, $2,000, 20% of $10,000. And the silver 94 is going to be $1,000 or 10%. So even though those plans do not have a medical deductible, the healthcare costs can still be substantial and unexpected. The Gold and Platinum plans have no medical deductible, and the outpatient procedures for the Gold is 30% and the Platinum 10%. You go straight into that coinsurance. Durable medical equipment is a little bit less with the Gold at 20%. The advanced imaging is also a little bit less at 25% for the Gold, still 10% for the Platinum. And inpatient hospitalization is the standard 30%. Now, I did note that on some of the evidence of coverage, they note that the mental health outpatient percentages may be lower than the kind of the standard on the Gold plans. So, but it can still be kind of unexpected, and we do run into situations where I'm not exactly sure how it all works, but sometimes when you visit a doctor that is associated with a hospital in an outpatient situation, you get billed not only for the office visit, but also coinsurance, even if it's just kind of a consultation. I'm not really sure how that all works, but we do see in the evidence of coverage, like in this one here, outpatient department hospital, the visit should be $95 under this particular plan. But then you scroll down and outpatient facility services, department of a hospital, treatment of an illness or injury, 30%. So carefully read your evidence of billing that you receive from your health plan to see if it comports with what the summary of benefits is for the plan. And if you have questions, I don't understand, what's this percentage for? Call them, call your agent to have it explained. We also see, like sometimes on the imaging, you may go in for like an MRI or something like that. With the silver plan, the copayment is $325. But there are times when with that, like a CT scan, they have to inject a dye for better resolution. Well, your CT scan may be $325, but you're going to get hit with coinsurance 30% for the outpatient procedure to inject the dye into you. So that can be kind of unexpected. Obviously lower if you have a enhanced silver plan or a platinum plan. Of course, there will be many services that are zero cost, preventive, and also reproductive services. The added to the zero cost column under reproductive health care is vasectomies. This year for 2024 will be zero cost. And of course, pre and postnatal office visits and abortion related services will be zero. But it can be tricky. Health plans are complicated, and you think it's going to be a set copayment, and boom, all of a sudden you get another bill for 30%, and it was completely unexpected. If you have any comments or questions, you may leave those down below and I will do my best to answer them. Otherwise, for InsureMeKevin.com, I'm Kevin Knaus.